Matt Webber on ABC Gold Coast.
With the surge in population growth in the city's northern suburbs, medical professionals in the area are struggling to keep up with demand. Keen to hear what your experience is. Here on our Facebook page, an earlier post, Peter says 2 weeks to get into her local doctor. Monique says 17 years at the same practice. We've moved. Hasn't helped. Now instead of waiting hours, walk in, can't make appointments. We have to make appointments 2 weeks in advance. I'm not sure that's progress at all. Tracy says it's a joke. 3-hour wait sometimes, and that's for my daughter and a child. That's once you're in and you've got your appointment. Whole thing's a joke now, she says. Dr. Tanya Uni runs 8 practices on the Gold Coast, and Dr. Uni says she's had a 20% increase in the number of patients she sees recently. Speaking here to the ABC's Sarah Cumming.
We did not predict. A year ago, we were worrying about the coronavirus situation, keeping patients safe and all that. However, now, because there's more people in the community, so our response, we have to gear it up and make sure our patients are being seen the same day. Everyone who needs a doctor's appointment needs to be given an appointment on the same day. So that's been our motive, our efforts, and our mission. So there is a lot of pressure. We are trying our best to cut short the waiting times. Yeah, so there is, definitely the increase in workload and the inability to recruit more doctors because we are in a city area.
How do you approach that challenge then? How do you go about finding doctors?
Very good question. So our doctors have been really amazing, the team of doctors that we have, and I'm sure most of the doctors in other centres as well. We are trying our best. We are trying to prioritize whoever needs to be seen immediately, especially kids and people with chronic diseases. So prioritizing, yes, and with our clinic, since the last 1 year, we have set up a call center. So what happens then is, anyone who calls, we are able to do a primary kind of triage. And then because we have the 8 centers across Gold Coast, we are able to give these patients an appointment with a doctor within our M10 so that we can at least help them on the same day. It's how we cope. Answering that question again is establishing system, prioritizing, training the front receptionist, training the person who picks the phone up, and also educating and upskilling our nurses to identify and react to patients' cues. We are in the search of more doctors to join our team. The search will definitely continue, but in the meantime, we still need, we are medical providers. We have to service the community as much as we can. Last year, even in September, we had launched antenatal clinic to cater for women, pregnant ladies who, in case if we are into COVID situation crisis, so we can look after our our pregnant ladies and antenatal patients in the community. So even then, at that time, the statistics was alarming. The number of people moving to Pimpama or more area. But now, I think in the last 3-4 months, I think it's gone beyond my imagination and my predictions. We did have, as community leaders, we had a strategy meeting not very long ago, last week, in Pimpama to try and brainstorm how we can help the community because there's a growth, there's a surge, there's an increase in growth as well as mental health, burden of mental health diseases, a lot of children moving to the area. So, yeah, we have got vulnerable people, and how are we going to cater? So, as in the community, with the community leaders, we are trying to brainstorm and see what can be done to help the situation. We can see the change of demographic. Before it used to be more older people, but now there are a lot of young families coming in, and there are a lot of pregnant ladies, there are young moms. So the demographic has completely changed, and hence the need is big. So if anything, I would really, the other thing is the cases of domestic violence, drugs, and those possibilities are will be there as well. Then there's the surge that we have to keep in our mind about those things and equip ourselves with the skills and training for that.
Pretty interesting. Dr. Tanya Uni is her name. She runs practices right around the Gold Coast, but speaking about the shortage of doctors in our north.